Hey guys, Dr.Ashwin here. I've spoken a lot of things about the coronavirus in my previous videos. This video is going to be a continuation of those videos. And right now, especially in our country, there is so much fear around this pandemic of coronavirus. First and foremost, I would like to request you this one thing. Let's not panic. This is the time as a country, we have to stay calm, we have to be resilient, and we have to come together to fight the virus, right? So two important things I would like to talk about the coronavirus in this video are the two important factors how we could control the spread of the virus in the upcoming weeks, because right now we are in stage 2. Let me first break down the stages of a pandemic. First and foremost, there are 4 stages in a pandemic. Number 1, when we hear about an infection in a different country. Number 2, when the infection comes to our country, that's stage 2, and there is a risk of spread from that person to our people or the local population in the country. Stage 3 is when it starts as a community spread. Stage 4 is out of our hands. We really can't find out where exactly the spread or the locus of these spreads happen. So right now we are in stage 2. Italy is right now in stage 4. China was in stage 4 and they fought out of that. Italy is really facing a lot of these, lot of or higher death rates, mainly because they did not follow the social or the isolation part or the quarantine part. So, but one good thing about where we are today is that we are in the stage of transition from stage 2 to 3. So, which normally takes around 2 weeks to 30 days. So we have that cushion. So it narrows down to how well we take care of ourselves. How well we take care of others, how well we follow the instructions of the government as a population in the next 2 weeks is what is going to determine the outcome of the disease or the number of deaths or the number of infections which is going to spread. The whole prognosis or a whole, the outcome of the coronavirus pandemic in India is going to be defined well with how well we take care of ourselves. So guys, I've already spoken about what foods to eat, what not to eat in my previous videos. That's one. The most important 2 points I would like to talk about in this video is, number 1, as I said, self-isolation, and that curfew, proposed by our Prime Minister starts this Sunday. He's proposed it only for 1 day, starting from 7 a.m. to 9 p.m. in the night. But my advice as a medical professional is, for the next 2 weeks, we all, as human beings, we have to be careful. We should avoid, social gatherings. We should avoid parties. We should avoid gatherings or any kind of a situation where there are more than 10 people. WHO normally tells that, anything more than 8 to 10 is a significant number where there could be a rapid, rise in the spread. So let's avoid all these things. And I'm glad that the theaters and the public places and public gatherings are banned temporarily by the government, because it definitely prevents the spread of infection. Let's avoid, I'm from Chennai. So basically, even though the public's, places are banned, the gatherings are banned, we have spots like these, the beaches and the parks. So my kind request is, guys, please avoid going to these kind of open places. Stay as much as home as possible, because, that's the best way to prevent the pandemic from going from stage 2 to stage 3. Not just that, after Corona has fought after China has fought the coronavirus, they've come down to one very important conclusion. See, apart from their healthcare workers, apart from, the other measures what they took, the most important measure which helped them single-handedly was self-isolation and quarantine. Basically, cutting yourself off from, public places, public gatherings, more people, and whatnot in whatsoever way it is possible. So quarantine, self-isolation, and a home quarantine, whatever you call it, right? Basically, social distancing. You try to distance yourself from the other person or the community or whatever it is. So that's one important thing which has really helped them to fight coronavirus. And number 2, Italy. Please don't. We are seeing a lot of photographs online about Italy. We're seeing a lot of, I don't know. See, a lot of things. The government per se has not released a lot of facts. Okay, we should believe only the government trusted sources, be it the website or the WhatsApp forwards or the pictures, whatever we see, because there are a lot of these unnecessary things which create more panic and fear. I saw a lot of pictures. They claimed as if it's come from Italy, but I don't think real pictures have come out from Italy right now. So please don't panic. But the statistics, Bloomberg has released its statistics saying that 0.2%. We don't have to really get scared about the mortality rate, basically the death rate of coronavirus, because If you actually see the death rate, up to the age of 60, it is only 0.2%, but it escalates significantly in the population when they cross the age of 60 to 85, right? And most of the people who have died, belong to the bracket of 65 to 85, and the average death in Italy, the mean age has been told as 79. So basically, older people, senior citizens are at a higher risk. So let's take the responsibility to protect them also. Ask them not to come out of their houses for the next 2 to 3 weeks till the government announces the clear-cut guidelines. And, as I already told you, let's avoid public gatherings, social gatherings, networking and all these things. Let's put all these things aside and let's stay put at home. And that's one single way, one very important way by how we can effectively prevent the transmission of this coronavirus. And right now, we don't have to panic. As I said earlier, let's stay calm as a country. This is the time when we have to come together, stay calm, collect ourselves together, spend some quality family time, put away WhatsApp and other social networking sites a little aside, stop watching news for some time, because there's constant bombardment of a lot of these negative things which people themselves are not sure about, right? So, but the self-isolation, social distancing has definitely proven to be effective in preventing the transmission of the virus and even controlling the virus spread to a significant extent. So guys, let's follow that. Right now, let's not panic. I'll be posting more videos in the upcoming days, and I will be constantly updating you guys about the progress of this coronavirus pandemic and how our country is taking steps, or what are we doing, as a population, as a collective population, and whatever I can, I'll be posting more videos about that. And right now, as I said, please take care of yourself, self-hygiene, and as I said, social distancing, or self-quarantine or home quarantine, whatever you call that as. So let's stick to that for now. And it starts tomorrow. As we all know that the curfew the Prime Minister proposed to us from 7 a.m. to 9 p.m. tomorrow. It's going to be a trial curfew. And after that, more significant announcements are expected from the Health Ministry. For now, as a country, let's stay together. Let's fight the coronavirus pandemic together. And for now, please guys, don't panic. Everything is going to be controlled. Or everything is going to be under control if we handle the next 2 weeks well, as per the instructions by the government, especially distancing ourselves from the public and avoiding as much as person-to-person contact as possible, guys. Thank you. See you soon in another video, guys. Stay safe. Love you all. Don't worry. Jai Hind.